Hi, I'm Dr. Dan Valaik, hip and knee replacement surgeon at Riverside Orthopedic Specialists. Today I'd like to talk to you about partial knee replacement. I think of partial knee replacement as essentially half of a total knee replacement. If you look at the implants, they're half the size. The recovery is half as long. The post-operative pain is usually half as much. While some total knee replacements are done on an outpatient basis, all of my partial knee replacements are done as a same-day surgery, and patients can recover in the comfort of their home. The key to a partial knee replacement is patient selection. Identifying a patient who has isolated arthritis to one compartment of the knee and then replacing that compartment will relieve their knee pain. Anytime I do a partial knee replacement, I'm prepared in surgery to do a full knee replacement if necessary. I ask for the patient's permission to allow me to make a final intraoperative decision about what will suit and fit the patient best. Preoperatively at Riverside Orthopedics, we treat our partial knee replacements just like our total knee replacements. They go through a full preoperative workup to prepare them for surgery. They go through our joint university and get all the same educational materials, so they're really ready to recover from their knee replacement surgery, although just a partial knee replacement. So at Riverside Orthopedics, a partial knee replacement will go through the same rigorous pre-op testing and preparation to have the same great result afterward.